So the next tier are called the innovative options, and those three options within this innovative sphere are trying to slow down the gland loss better than anything else that we have, which the alternative is the warm compress routine. So these three options, the first one is called LipiFlow. It's in a category called thermopulsation. There's now something called iLux and Meibo, which also are categories in there, and that's FDA approved to slow down the gland loss. And what that procedure is a 12-minute procedure. It's an apparatus that literally covers the whole upper and lower eyelids of all four eyelids. It's done at the same time. It provides heat and compression. And the amount of heat that it does is enough, it's been studied to actually liquefy the oil. So as the machine actually milks out the oil, you're trying to push all that oil out so the body produces more oil. It's just like milking a cow. It's recommended at least once a year, if not twice a year, especially if somebody cannot do the warm compresses or they're sensitive, their skin can't tolerate it. Some patients, if they do the warm compresses and they have LipiFlow, the effective LipiFlow can last up to 2 or even 3 years. So the best is warm compresses with LipiFlow every year or 2 years. The second option is called Intense Pulse Light, and that is something that's been available for the last 7 years or so, which is a very bright light that we shine along the eyelids. Intense Pulse Light has been used for years for cosmetic, helping women with wrinkles or discolorations of their face, but now what we know is that if we shine it close to the eyelid margin, we put a metal contact lens or a cover over the eye, and then we express the oil under a microscope and a video camera, we can show patients the quality and the quantity of the oil coming out, which is crucial because it tells you the prognosis. It tells you how many IPLs you're going to need to get better. It tells you if you're going to get better. It tells you what you need to. It really gives you so much information. So we love Intense Pulse Light because it's very safe. It is very quick and it is not too uncomfortable. The third option is probing. So Meibomian gland probing is much more uncomfortable than thermopulsation LipiFlow IPL. It is a probe, a sterile probe that we go into every single gland trying to break open the scar tissue. So again, if you look at this photo of the Meibomian glands, if you have a situation where you have a gland that's kind of disappearing, if we go in with a probe, we can break open the scar tissue, and we believe that that probe is stimulating the stem cells in that gland to produce more oil. And so it's something that we sometimes will combine with Intense Pulse Light to just stimulate the oil glands.